Eating disorders are complex mental health conditions characterized by persistent disturbances in eating behavior and intense preoccupation with body weight, shape, and food. These disorders can affect people of all ages, genders, and backgrounds, though they are often most prevalent during adolescence and early adulthood. The three most common eating disorders are anorexia nervosa, bulimia nervosa, and binge eating disorder. Each of these conditions has unique symptoms and challenges, but all share a common thread of significant emotional and psychological distress related to food and body image. Recognizing the signs and understanding the underlying causes of these disorders is crucial for providing effective support and treatment to those affected. Anorexia nervosa is characterized by an extreme restriction of food intake and an intense fear of gaining weight despite being underweight. Individuals with anorexia often have a distorted body image, perceiving themselves as overweight even when they are dangerously thin. This disorder can lead to severe physical health complications including malnutrition, electrolyte imbalances, and organ damage, which can be life-threatening if left untreated. In addition to the physical effects, individuals with anorexia may experience intense emotional and psychological distress, including anxiety, depression, and their preoccupation with food and dieting. Treatment for anorexia typically involves a combination of medical intervention, nutritional counseling, and psychotherapy to address both the physical and emotional aspects of the disorder. Bulimia nervosa is another eating disorder that involves episodes of binge eating followed by compensatory behaviors such as self-induced vomiting, excessive exercise, or the use of laxatives to prevent weight gain. Unlike anorexia, individuals with bulimia may maintain a normal body weight or be slightly overweight, but the relationship with food and body image is still deeply troubled. The binging episodes are often triggered by emotional stress or feelings of shame, and the compensatory behaviors are driven by a desire to regain control over food intake and prevent weight gain. Bulimia can result in serious health problems, including dehydration, gastrointestinal issues, and dental erosion from frequent vomiting. Like anorexia, bulimia is often accompanied by other mental health issues, such as anxiety and depression. Treatment for bulimia typically involves psychotherapy, such as cognitive behavioral therapy, to help individuals change unhealthy thought patterns and behaviors, as well as nutritional counseling to restore a healthy relationship with food. The binge eating disorder is characterized by recurrent episodes of eating large amounts of food in a short period of time, accompanied by feelings of loss of control and distress. Unlike bulimia, individuals with binge eating disorder do not engage in compensatory behaviors such as vomiting or excessive exercise. Instead, they may feel ashamed or guilty about their eating habits, which can lead to emotional eating or a cycle of dieting and overeating. Over time, this pattern of behavior can result in significant weight gain and increase the risk of developing obesity health conditions such as diabetes, high blood pressure, and heart disease. Treatment for binge eating disorder often involves therapy such as cognitive behavioral therapy or interpersonal psychotherapy to address the underlying emotional issues and develop healthier eating habits. In some cases, medications may also be prescribed to help manage symptoms and reduce the frequency of binge eating episodes. Recognizing eating disorders early is essential for effective intervention. However, many individuals with eating disorders may not seek help until their condition has become severe, as they may be ashamed of their behavior or afraid of losing control over their weight. It is also common for individuals with eating disorders to hide their symptoms or deny that they have a problem, making it challenging for family members, friends, and healthcare providers to identify the issue. Some signs that may indicate the presence of an eating disorder include drastic changes in weight, preoccupation with food and dieting, excessive exercise, and frequent trips to the bathroom after meals. Individuals with eating disorders may also display symptoms of anxiety, depression, or low self-esteem, which can further complicate the diagnosis and treatment process. Mental health professionals, particularly those specializing in eating disorders, can provide a comprehensive evaluation to determine the appropriate course of treatment. The causes of eating disorders are complex and multifactorial, involving a combination of genetic, psychological, and environmental factors. There is evidence to suggest that certain genetic traits may make individuals more vulnerable to developing eating disorders, particularly if they have a family history of mental health conditions. Psychological factors, such as low self-esteem, perfectionism, and a history of trauma or abuse, can also contribute to the development of eating disorders. For example, individuals who have experienced physical or emotional trauma may use food or body image as a way to cope with their emotions or regain a sense of control. Social and cultural influences, such as the prevalence of idealized body images in the media, can also exacerbate feelings of inadequacy and pressure to conform to unrealistic standards of beauty. Understanding these underlying factors is crucial for developing effective treatment plans that address not only the symptoms but also the root causes of the disorder. Recovery from an eating disorder is a long-term process that requires commitment, patience, and support. While it is possible for individuals to fully recover from an eating disorder, the road to recovery can be challenging and may involve setbacks along the way. A key component of recovery is developing a healthy relationship with food and body image. This can be achieved through psychotherapy, which helps individuals identify and challenge harmful thought patterns such as perfectionism, negative self-talk, and the fear of weight gain. Nutrition counseling is also an essential part of recovery, as it helps individuals learn how to nourish their bodies in a balanced and sustainable way without resorting to restrictive dieting or unhealthy behaviors. Additionally, individuals in recovery may benefit from support groups where they can connect with others who are going through similar experiences and share coping strategies. One of the primary goals of treatment for eating disorders is to restore physical health and address the underlying psychological issues. Medical intervention may be necessary to treat complications caused by malnutrition, dehydration, or other health concerns. In severe cases, hospitalization may be required to stabilize the individual's condition and provide intensive care. Once the individual's physical health is stabilized, therapy can focus on the emotional and psychological aspects of the disorder. Cognitive behavioral therapy, which helps individuals recognize and change unhealthy thought patterns, is one of the most effective therapeutic approaches for treating eating disorders. In some cases, family therapy may also be beneficial, as it can help family members understand the disorder and provide support in the recovery process. The recovery process can be especially difficult for individuals with eating disorders who are also struggling with co-occurring mental health conditions, such as anxiety, depression, or substance abuse. It is essential for mental health professionals to take a holistic approach to treatment, addressing not only the eating disorder, but also any other underlying issues that may be contributing to the individual's emotional distress. In some cases, medication may be prescribed to manage symptoms of anxiety or depression, but medication should always be used in conjunction with therapy and other forms of treatment. Recovery from an eating disorder is not a linear process, and it is important for individuals to remain committed to their treatment plan, even when faced with setbacks or challenges. Support from family, friends, and loved ones can play a critical role in the recovery process. Family members can help by providing emotional support, encouraging the individual to seek treatment, and being patient as the person works through their recovery journey. However, it is important for family members to educate themselves about eating disorders and avoid enabling behaviors, such as making comments about weight or food. In some cases, family therapy may be beneficial in improving communication and addressing any family dynamics that may contribute to the individual's eating disorder. Additionally, joining a support group or connecting with others who have experienced eating disorders can help individuals feel less isolated and more understood. Prevention of eating disorders is a critical aspect of reducing the incidence of these conditions. Education and awareness about the signs and symptoms of eating disorders can help individuals, families, and communities recognize the problem early and seek treatment before the disorder becomes more severe. Schools, healthcare providers, and community organizations can play a key role in promoting healthy attitudes towards food and body image, as well as providing resources for individuals struggling with eating disorders. Additionally, efforts to reduce the stigma associated with mental health conditions and eating disorders can encourage more people to seek help without fear of judgment. Early intervention, combined with comprehensive treatment and support, can improve the chances of recovery and help individuals lead healthier, more fulfilling lives.